There has been a lot of variation in number of people testing from each and every month. You find that this month, very many tests. Next month, supplies are not there, very few tests. And basically, it is affecting our services because even people are getting discouraged. Say when you go to the hospital, possibly things are not in place. Like for the past 1 year ago, we had over 11,000 people who tested for HIV. That is in 2007. And 2008, we had 9,000 people who tested. And simply because the number went down because logistics were not adequately supplied. Basically, that is the reason. Otherwise, very many people are willing to test. I believe all the sensitization on the radios all over, the LCs, the popular chiefs, they are really trying their level best to sensitize people the importance of testing for HIV. And that's why we are getting large volume of patients coming to test.
The lack of containers affects the work in such a way that people will get demoralized and will get a lot and those who are HIV positive and do not know their status continue as like any other normal person. So they pass the HIV to their babies. And they even maybe they can even deliver from the villages where there are these traditional birth attendants. But if one is cancelled and has known that she is positive, she's given information, she will take trouble to come and deliver in the hospital.
In January of 2000, the Ministry of Health initiated a free prevention of mother-to-child transmission service and a few antenatal clinics. This provided counseling and rapid testing to all mothers who attended the clinic and resulted in treatment of the mother and child following a positive result. The outcome was encouraging, and PMTCT has greatly expanded from 2005 to 2007, resulting in 80% of pregnant women attending antenatal clinics being tested for HIV. Recent figures show that 25% of new HIV infections occurred through mother-to-child transmission. There are an estimated 100,000 children currently living with HIV in Uganda. Due to this, Uganda's 2008 national plan has focused on reducing PMTCT with the goal of cutting mother-to-child transmission in half by 2012. The antenatal clinic in the Uganda hospital is providing counseling, testing, and antiretrovirals to pregnant mothers who come for services.
The process of PMTCT starts right from antenatal. That's when the mother comes to attend antenatal. When a pregnant mother comes to attend antenatal, the mothers are given a general health education, talks about prevention of mother-to-child transmission. They share with the health workers the information they know, then the health workers build on them. Now the information they share mostly is how does an HIV positive mother infect the baby. Once the mother has been diagnosed from antenatal that she's HIV positive, she's enrolled in PMTCT program. She's encouraged even to bring her husband for a test so that we rule out whether they are discordant, whether they are HIV positive, and they will be attended for. The mother will be put in antiretroviral therapy. That is when she will be given from 28 weeks of pregnancy to take the ARVs, which will suppress the virus so that the virus will not be able to pass to the baby. Then during delivery, the mother will be monitored closely by the midwives and make sure that the mother is delivered in a systematic way to avoid her infecting the baby, and then the baby will be given the syrup.
In 1998, Uganda became one of the first African nations to begin distributing life-saving antiretrovirals. The aim of the program was to assess the ability of resource-poor countries running an antiretroviral clinic. It was not until June 2004 that Uganda began providing free antiretrovirals to HIV-infected persons. In 2008, the number of people on treatment rose to 110,000, which is about half of those in need. In 1999, the Joint Clinical Research Center stepped in to provide antiretrovirals at the Uganda hospital due to the high demand across the country. Previously, people from Uganda were being referred to a nearby region, yet the transport made them unable to reach treatment and they would be left to their deaths. Beginning with only bi-monthly visits, people started flooding in to receive treatment in Uganda, overwhelming the new clinic. Thus, they decided to implement a permanent clinic and health providers. The effects of HIV are beyond just medical and require supportive care in order to live a healthy life. Along with the provision of drugs, counseling services are provided to restore hope and motivate positive living in HIV-positive patients.
And we do tell them that we have seen people who have been having HIV. They have learned, they have masters, they are working, they enjoy their life, they have families, they have daughters, as a normal person is.
What I teach people about positive living, first of all, somebody has to accept that he's HIV positive. And after accepting HIV positive, he has to support himself by having a well-balanced diet, that is eating nutritious food so that his immunity will be boosted up, drinking clean and safe water, which can be treated by water guard or boiled, sleeping under a mosquito net to avoid frequent attacks of malaria, and then seeking for medical treatment whenever he's sick, and mostly changing his behavior, avoiding many micro partners or using a condom.
To maintain and support the health of their clients, the ART clinic staff must supervise their patient's condition and home environment to ensure proper HIV treatment and care.